Hello, my name is Diego Ferreira, and my presentation is on the effect of body position and external load on knee joint kinematics during the pendulum test in typically developing children. The pendulum test is used to measure passive stiffness about the knee, but the procedures found in the literature are inconsistent. There are three body positions that are typically used: an upright seated position, a supine position, and an inclined position, but with varying angles. In a previous study, we found that including an additional ankle load may assist passive motion in children, including children with Down syndrome. Therefore, the purpose of the study was to determine if body position and ankle loading influences the performance of this test in typically developing children. We predicted that body position would affect the knee joint kinematics due to the difference in the resting length of the quadriceps and the different seated positions. We also predicted that the ankle load conditions would significantly increase passive motion of the lower leg due to the increased moment of inertia. 15 children participated in the study. To complete the pendulum test, subjects sat on a table with their legs hanging over the edge. Each subject's dominant leg, which was determined by having each subject kick a soccer ball, was raised so that the knee was in an extended position, as seen as point 1 on the image to the right. The subject was asked to relax. The leg was released once the subject was relaxed. The leg swung freely until it came to a complete stop, as seen in point 2 on the image to the right. Practice trials were given to the subjects to ensure they could perform the activity without resisting the leg swing. 3 body positions were included, using an upright, supine, and an inclined position with a 45-degree angle with respect to the horizontal. A back support device was used for the upright and inclined positions to ensure the subjects maintained the correct posture. 3 load conditions were used, equaling 0, 3, and 6% of each subject's body mass. The external load was attached using ankle weights represented by the white boxes on the image in the upper right. These percentages were based on our previous study that found that 2% of body mass demonstrated positive trends. The average weight for the 3% condition was about 2.5 pounds and 5 pounds for the 6% conditions. Subjects completed 5 trials for each condition in a randomized order with 10 seconds between each trial and 5 minutes of rest between each condition in a total of 9 conditions. We calculated number of cycles or leg swings, which was determined as the time period between 2 flexions, as for example between flexion 1 and flexion 2 onto the image to the right, with a cutoff of 3 degrees towards extension. The maximal amount of flexion during the first flexion excursion was determined as seen as A1 in the image to the right. A relaxation index was calculated as the maximal amount of flexion during the first flexion excursion divided by the difference in the starting and resting angle. A typical relaxation index of less than 1.6 indicates passive stiffness. We conducted a series of 2-way repeated measures ANOVAs with repeated measures on position and load. Post-hoc pairwise comparisons with bone Ferroni adjustments were conducted with necessary with an alpha level set to 0.05. The results of this study indicate that body position does not affect the performance of this test. Although there was a statistical difference in the number of cycles between the upright and the other 2 positions, those differences are not clinically meaningful. However, the use of the ankle loads did significantly increase passive motion of the lower leg. Number of cycles, the relaxation index, and maximal flexion during the first flexion excursion increased significantly with the increase in ankle load for both the 3% and the 6% ankle loads. Our results are consistent with results we previously obtained using healthy young adults. The ankle load conditions significantly increased the passive motion of the lower leg, which was likely due to the increased moment of inertia. Our results also indicate that body position most likely does not affect the knee joint kinematics of this test. This may be because the resting length of the quadriceps may not affect the passive stiffness in healthy individuals. There is still a need to study the muscle activity of the quadriceps to further understand the effect of body position and ankle load on the pendulum test. This study does provide basic information for future study in clinical populations. This information could be beneficial to determine if body position affects the performance of this test in those populations, as well as if external loads can be used as a therapy modality to reduce passive stiffness. Thank you for watching my presentation.